Republicans are under a lot of criticism from those on the right for not taking steps to defund Obamacare in a recent $1 trillion spending bill, or should I say for not taking steps to make the implementation much more difficult of Obamacare. Joining me this time to comment on this and other matters related to that is David Hogberg. David Hogberg, of course, is a healthcare analyst with the National Center for Public Policy Research. David, welcome back to the show.
Thanks for having me.
And David joins us from our Washington, D.C. studio. All right, David, so Republicans are under a lot of criticism from those on the right in this $1 trillion spending bill over the funding of Obamacare. But as I see it, it's not quite that simple. I mean, yeah, they didn't take steps to block the funding. They didn't take steps to defund it, but there's no new money going in. There's no funding for the IRS, as well as Centers for Medicare and Medicaid, which are responsible for implementing the new law. And they even reduced the budget for the Independent Payment Advisory Board, which we'll talk about in a moment. So there were some steps taken, were there not?
Oh, yes, there were. And I'd first say, look, if they were to try to completely defund Obamacare, that would just lead to a government shutdown. And we know that those usually turn out badly for the Republicans. So I've got to go with the Republicans on this one, as loath as I am to do that sometimes. And there was another actually good thing in the omnibus, and let's hope it stays. That is, there is language that basically prevents the insurance company bailout, the risk corridors, from going forward. The way the risk corridors are supposed to work, Congress is supposed to appropriate money for them. The Republicans have refused to do that, and so what President Obama has promised the insurance companies is, look, we'll find the money in some fund in Health and Human Services. Well, there's now language in the omnibus basically prohibiting that from taking place. Now, to be fair, of course, President Obama has been creative, to say the least, in finding ways around the law. So, you know, who knows if that language is going to be effective. But it is in the omnibus. There is potential, if it does stay in there, that there would be a win for taxpayers on this.
So, yeah, so indeed, I agree with you. As much as I may not like Obamacare, I see the spending bill as it relates to the Affordable Care Act, and what I see is the results of a divided government. This is how our system operates. We don't want to see Republicans shut down the government. That's a political loser. So do what you can to get the bill through, to keep the government open, to not take the political heat for being labeled as an obstructionist, but hit those areas of the implementation of the Affordable Care Act which will affect it. And that's what appears to have been happening here. Tell us, David Hogberg, about the Independent Payment Advisory Board, because I believe there's a lot of people out there who still do not understand how this operates. Of course, Republicans at one time called it the death panel, and they've been lampooned, if you will, for being accused of exaggerating and fear-mongering with that term. Tell us what this panel is, and whether or not you feel the death panel is the right slang to use for it.
Well, a couple things. Basically, IPAB is a panel that's supposed to of doctors and other healthcare professionals that is supposed to be set up to make cuts in Medicare whenever Medicare grows too fast. And they're supposed to find, new ways to, I guess, supposedly creative ways to make cuts into Medicare to bring it back into balance. But and I'll say that I think the term death panel is correct, because what these types of panels usually end up doing is they usually end up cutting health care for the sickest. You see this, for example, in Britain, which has this a similar organization called the National Institute for Clinical Excellence, has this kind of creepy acronym known as NICE. And what do? Well, they cut back on medicines that help cancer patients live a little longer. So I think IPAB, if you look at the history of these organizations elsewhere, calling IPAB a death panel is actually accurate. And if I could say one thing about the Republicans cutting $10 million from IPAB, I won't say it's bad for them to do that, but I do think it's a little bit symbolic because right now there is no IPAB. That is, President Obama has not nominated anyone to be on IPAB because it is, I think, so politically toxic. So you're basically cutting funding for an organization that's not up and running, which I think makes it a little bit symbolic. Now, if IPAB ever did get up and running, they would find themselves with $10 million less to operate, which, is, if you're looking toward the future a little bit, would be good, and it, would help prevent mischief and really, potentially dangerous problems on their part. But for the time being, I just, I have to say it is a bit symbolic.
All right, David Hogberg from the National Center for Public Policy Research, healthcare analyst. Thank you for joining us. Our grassroots